Well, it's always great to talk hope, health, and healing for all with Michigan State University's Executive Vice President for Health Sciences. That's Dr. Norman J. Beauchamp, Jr., and it's great to welcome Dr. Beauchamp back to MSU Today. Great to see you, Norm.
Russ, thank you. I'm always uplifted by our conversations. I still remember our first discussion, I think in the fall of 2016 when I came back, about what we hope to accomplish, and you've been such a partner in helping people know and bringing folks together. So thank you.
Well, it's my pleasure. And we'll talk about a couple of things in a little bit. Norm is the executive sponsor of the Sustainable Health theme of MSU Strategic Plan 2030. We'll see how that's going. But first, Dr. Beauchamp is just back from Detroit. Many of you know that Henry Ford Health plus Michigan State University Health Sciences partnership is a couple of years old now. Some major announcements today as that partnership evolves, and some other things Henry Ford is doing. We weren't the only topic, but talk about what you heard today, Norm, the excitement, and how our partnership with Henry Ford is evolving.
Yeah, thank you, Russ. So today was a very exciting day. In Detroit, we announced a $2.5 billion campus design in Detroit. And what it brings together is the Henry Ford Health System, Michigan State University, and Tom Gores and the Pistons. And what's wonderful about it is the first thing this creates is this world-class destination for healthcare, where you have fully integrated the very best in care, but then all the strengths and discovery that you find at a place like Michigan State. And in the goal and really putting them side by side is that every single day you can say, what could I have done better for my patient today? And then have the people that are involved in education and discovery to solve that. So side by side, we'll have this campus redesign, but we'll also bring up a building that will be dedicated to having MSU researchers side by side. The second thing about this campus redesign is we thought to ourselves, what would it look like to create a world-class place to educate nurses and doctors? And if you think about this environment where you're practicing the very best in healthcare, that's exactly where you want to bring your nurses and doctors and your scientists all together. So really excited about that. One of the things this also means, Russ, is that in doing this design where there'll be a new research building, there'll be continued work by the Pistons organization, and then the Henry Ford redesign, is it creates an economic uplift because there'll also be residential housing, there'll be food markets, there'll be restaurants, there'll be affordable housing. And when you bring all of that together, what this results in is there's been a lot of work in downtown central Detroit and really uplifting an economic uplift. This now moves out into the neighborhoods in a way that just really catalyzes transformation for all, both in delivery and health, keeping people healthy, and then access to opportunities.
Providing that hope, health, and healing for all goes a long way towards that.
Thank you. Yes, Russ.
And Norm, part of that medical research facility, our faculty will be doing research in there. And is that part of the cancer center you said you were seeking as part of the partnership?
Yes, Russ. So the partnership is going so well. We started discussions in 2018. We signed the agreement in 2021. And since that time, 110 researchers that are focused on human health have come into this new entity, which is Henry Ford Health MSU. 110. We also have brought in 85 clinician scientists that are focused on the very best care every single day. So that's already growing really quickly. And what we're seeking to do now in this research facility is to bring together the research teams. So there will be research teams in public health, artificial intelligence, machine learning, health disparities, and the biggest focus, as you called out, is cancer. We're going to go directly at earlier detection of cancer, treatment when it's responsive, and access to the very best care. So that's what that facility will be. It will be to house these individuals that have now come into MSU as MSU Henry Ford researchers, and then all of the additional researchers will recruit together as MSU now embraces this goal of getting to $1 billion in research and tripling our NIH funding.
And you've talked about the need for more diversity in the clinical trials as well.
Well, first, I compliment you. You keep track of so many of these things, and it's because you're so passionate about this. And that's exactly it. When somebody is at end stage and they've had access to the conventional treatments in cancer, that's when individuals and families, they're looking for, how can I fight this? And for too many people, they don't have access to the clinical trials, to these latest discoveries. And what will define our effort is bringing these clinical trials to all communities, and also to overcome some of the barriers to communities of color in terms of access to participation in clinical trials. And as you'll recall that we discussed, the other part of that is then by also bringing in people of all backgrounds into these trials, what you discover will then be able to help people of all backgrounds. And this opportunity in working with Henry Ford just gives us the chance to work with a partner who's trusted, who's been in that community for 107 years. So those barriers to access, they drop, and the opportunities to discover things that improve lives become realizable.
Because as you've said, your zip code should not determine the quality of health care you receive.
That's exactly it. Exactly. Yes, thank you.
So, Norm, before we move on to the strategic plan, just summarize kind of where we are, what you want people to know about the latest in our partnership with Henry Ford.
What I want people to know is there's moments in the history of a university where there's a transformation. I think the FRIB was an example. Never again will MSU will be a leader in particle physics forever. And this coming together with Henry Ford, and particularly the work that we're going to do in Southeast Michigan, Michigan State will be seen as one of the leaders of transformation of lives in the future of healthcare for Southeast Michigan, and Michigan State forevermore will be seen as a leader in healthcare. And what I will report is that the progress we've made in terms of creating increased educational opportunities for the College of Human Medicine, College of Nursing, College of Osteopathic Medicine, those have been realized. The bringing together our research organizations, that has been realized. We have also brought together our divisions of public health in a way where we're also working very effectively to keep people healthy. So if I was going to sum up where we are, we have really shown that this relationship is transformative to MSU. We have the momentum that we hoped we would have, and now it is built into the strategic plan because of the capacity it gives us to be a leader in sustaining health for all. So it's nice that we moved to the strategic plan, and in fact, being able to put the strategic plan together the way we did is because of the last 2 years and the progress that we've made with Henry Ford.
Great segue, Norm. And so it's the Henry Ford Health plus Michigan State University Health Sciences Partnership. Much more online, henryfordmsu.org. And now let's switch. As we said, Norm, you were the executive sponsor of one of 6 themes in the strategic plan, MSU Strategic Plan 2030. Sustainable health is the theme that you've been the executive sponsor for. Kind of what is it again? How is that evolving?
Yeah, thank you, Russ. Well, since Michigan State's establishment, 1855, we've been keeping our state healthy. We've been keeping our nation healthy through the work that we've done in agriculture, social sciences, communication arts, nursing, medicine, these have been strengths. And as I had the opportunity to talk with many of the faculty and under the leadership of former President Stanley, there was an opportunity to say, what could it look like if we brought those strengths together campus-wide and then continued to build on our relationships and partnerships with communities in terms of transforming Michigan State and the communities we serve. So the pillar that came out of that is called the Sustainable Health Pillar, Russ, as you know. The goal of this is to enhance the quality of life for people everywhere by comprehensively leveraging the expertise and research activities that improve health and systems, and to do that by bringing the strengths together across the campus. The objectives will resonate. The first objective is, how can we better meet the physical and mental health needs of our students, faculty, and staff? And this would make sense, right, when you think about when you're flying on a plane. They say put your mask on first, right? And so if we're going to set these transformative goals for what we can do with communities, we've got to keep ourselves healthy first. There's been a lot of that work done campus-wide. Vinnie Gore has been one of the tremendous leaders of this work with student success. Dave Wisemantel in his role as university physician, Rebecca Campbell in the work that she's done. And so this idea that first we have to focus on being the employer of choice, the place that looks after students. So that's the first part of the pillar. The second objective is to partner with communities and organizations to reduce health disparities by 2030. So, as we mentioned in the Henry Ford partnership, right now the county in which you live determines your access to health care and your outcomes. An example of that is that the incidence of cancer, many cancers, is lower in rural Michigan, but the death rate is higher. And that's because there's not enough providers. We don't get out and provide adequate screening so we can detect cancer early. So what Objective 2 is to reach out with communities and partner so that in those partnerships we can improve health outcomes. I think the very best example of that is the work that we're doing in Flint. And recently we announced a $25 million commitment from the Mott Foundation to Michigan State to build on our public health division in Flint. And what's so beautiful about that, I was in Flint for Martin Luther King Jr. Day, was this effort was really led by the community. They knew what the challenges were. They just need partners. And that was when MSU made themselves available. So what we want to do is really build on that work. The gift from the Mott Foundation, this Henry Ford partnership where we're taking some lessons learned in Flint. Now we're working with the Detroit community and then extending all of this work to every county in the state by partnering with Extension. That, my friend, is Objective 2.
Well, and I can see how it all fits together so beautifully, Norm. Oh. Flint and Henry Ford, this is amazing.
Well, bless you. Thank you. And then the third is to say, if we're going to improve health, this can't be a health college's focus, right? This can't be just the College of Nursing, College of Human Med, College of Osteopathic Med, College of Veterinary Medicine. The four of them combined were the largest trainer of graduator, if you will, of people going into health professions. But to get this right, we need to bring in communication arts and sciences. We need to bring in engineering, biomedical engineering. We need to think about food deserts and healthy foods, College of Agriculture, Natural Resources, right? All of these departments, social sciences, colleges, when they're brought together, there'll be no place better in the world to meet the needs of the communities we serve. So Objective 3 are what are the ways that we can bring the entire university together. Now, this partnership we announced 2 years ago, that's an example of an opportunity, and I'll elaborate slightly on that if you don't mind, Russ.
Please.
When I presented this, I went around and I met with all of the research deans. And the vice dean in the College of Business said, well, one of the biggest challenges in healthcare we saw was with COVID. We couldn't get treatment to people in the communities in which they were. How about if we bring our world-class supply chain into this partnership with Henry Ford and figure out what are the ways to better deliver the resources needed to people everywhere. Health, hope, and healing for all, right? We saw with our College of Communication Arts and Sciences the way in which you message to people about participating in a screening test can increase their willingness to participate 6, 7, 8%. So if we're trying to reach all the communities, we in the health colleges can develop the very best tests, but having the skills to get them there. So what brought Henry Ford into this partnership with MSU was the realization of the breadth of our strengths. What we now have to do as a part of our strategic plan is to mobilize the entire university. The beautiful thing about that is Objective 4. So Objective 4 then is when people, in 2017, the number one employer in our nation became health-related careers. We want to be a place that when students come here to prepare for a future career, it's the career of their dreams, of doing the things that are meaningful to them and making sure that it's a way for them to have a secure job. And so Objective 4 is, can we create 50 new pathways at Michigan State into careers in health? And really identify that. So if you want to improve the lives of your fellow human, so many ways to do it. Communication arts, having shows like this, an example, right? But another example is, as we talked about, supply chain, packaging, engineering. So we want to really identify Michigan State as the place to go as a student if you want to improve human health. And because of our depth and our breadth, you can choose so many different ways to get there. So that is Objective 4. And then Objective 5.
And thankfully, that the low barriers to collaboration on this campus really help out with that objective.
Russ, you call it out beautifully that I've been at other institutions, and one of the comments that you hear in some places that there's a moat, if you will, between colleges or between health-related colleges and the rest of the university. What this strategic plan does is it builds bridges, not moats, and it connects us. And because this is an institution that's been built on collaboration, these bridges become superhighways really quickly. And what I found as, I've gone around to the different colleges is just, how do we do more together faster? It's really quite remarkable. So, and it's really energizing. And then the fifth objective is really, and I think the Henry Ford partnership, or maybe even what we've done in Grand Rapids, is that as you bring together the delivery of healthcare, education, and research, because health is so important to individuals and communities, well, so many of our businesses in the United States, either the ones that are trying to emerge or that are trying to be more effective, they want to connect to that. And so you can create an innovation district that lifts up lives like none other. In Grand Rapids, right, 2017 we brought up a research building. 2021 we brought up 2 buildings that brought in industry partners. Now we've created a $3.5 billion uplift to the city of Grand Rapids. And so what we will do on this campus that we announced today, right away it's a $2.5 billion project in mid-Detroit, But this then will be an attractant to other partners, businesses, right? Internships for students at Michigan State, and really pathways of hope for all of the people of Detroit that really are looking for careers and opportunities in health. So it's partnering with communities to really create an uplift, jobs, access to education, and then maybe finally economic resilience. Yep. So those are the 5 pillars. And I got to tell you, Russ, it has been one of the greatest delights to have an organization say, we're going to call out very directly what we're going to do, and then we're going to put our shoulders behind it. So, yeah, I'm excited about it, and I'm excited about, coming into this summer. Now it's taking some of the proposals that have come from faculty to say, this is how I think, this is how we think we can advance these objectives, and then tying the budget to that.
Spartans will, Norm.
Spartans will.
And again, a lot more on the sustainable health theme of the plan at strategicplan.msu.edu, and we've been catching up on that. And the Henry Ford Health plus Michigan State University Health Sciences Partnership with Dr. Norman J. Beauchamp, Jr. He's MSU's Executive Vice President for Health Sciences. And any final thoughts, Norm? I got you warmed up.
Thank you, Russ. Yeah, you have me fired up, to be certain. I have the joy of getting to sit with you, but there's so many people that aren't in the room that made this possible. The Henry Ford Health Partnership, the gentleman named Norm Harbert who joined our team, Karen Crosby, Laura Kajita, these partners who, have been tireless in bringing the work together. And I really want to call out some of those team members. Nicole Simzak, who recently joined our team, has just been extraordinary. And so in bringing this together, so many people. But I will also give a shout out to former President Sam Stanley, who, when we talked about trying to do this in 2018, he said this will create a profound future for the students and the faculty at Michigan State and the people of our state. And he couldn't have been more supportive of this. And so we were fortunate to have his service during that time, and it's just been terrific. And so shout out to those team members and the countless other folks, Jerry Koyman, I could go on, that made this possible.
Hear, hear, Spartans will. Well, Norm, thanks for coming in again and for the update.
You're
Always
welcome.
Appreciate your passion for hope, health, and healing for all.
It's what people deserve, Russ. Thank you.
Dr. Norman J. Beauchamp, Jr. is MSU's Executive Vice President for Health Sciences, and I'm Russ White. This is